Many of us are paying closer attention to our health because of the pandemic. That's such a good thing, but there's also a lot of paranoia, anxiety, as well as fear. When we cough, sneeze, or have a sore throat, we immediately worry, especially with a sore throat since it can be a symptom of COVID-19. Remember, it doesn't always have to be that. A sore throat is generally caused by a bacteria, virus, toxins, and even irritants. The more important thing is it can be contagious. Here on the show today, we'll understand the types, causes, remedies, and when it's time to seek medical care. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Joining us on the program are Dr. Emmanuel Ibay. He's an ENT head and neck surgeon at St. Luke's Global City and Makati Medical Center. We also have with us Dr. Ranely Mendoza. She's a family medicine specialist and the residency training officer at Healthway Medical. Let's start off the show with a quick back to basics portion with Dr. Ibay. What makes our throats susceptible to infections?
Anatomically, as you know, is the tube all the way from the nasopharynx to the oropharynx and down to the hypopharynx, no? So that would be the back entrance, basically, of everything that we inhale. So a lot of particles that we inhale also settle in the pharynx area, and also viral particles and infectious particles. And that may point of entry, basically, of infective agents.
Dr. Mendoza, there are people who are more prone to sore throats. Why is that the case naman?
Usually with sore throats, as you have said earlier, there are a lot of causes, and the most common is infection. So people who don't have a very good immune system might be more prone to this, and also people with allergies, as Dr. Ibay said, because it's exposed to a lot of potential allergens, can also be more exposed to or prone to sore throat.
Okay, now I'll go back to Dr. Ibay. Could you explain what a person might feel when the part of their throat, from the nasopharynx, the oropharynx, and the laryngopharynx?
Well, if it's allergy causing, usually this can be caused by postnasal drips from the sinus drainage of mucus, which may thicken and then cause irritation in your nasopharynx and your oropharynx. And if it's infective agents, usually this can be caused by pain also from inflammation of your oropharynx and also inflammation of your tonsils, which basically act as filters to infective agents, preventing the infection from going down to the lower tract and causing more severe infections like pneumonia.
Now, naturally so, if it's sore, it's painful, which is one of the symptoms of a sore throat. Now, continuing with Dr. Ibay, before we go to other symptoms of a sore throat, why does it hurt? What causes that pain that people feel?
Well, for allergic symptoms and sinusitis symptoms, thick postnasal drips can actually cause the irritation and inflammation, secondary inflammation of your oropharynx. No? For infective agents like bacteria and viruses, the inflammation would be caused by inflamed tonsils or what we call lymph adenoids, are filters of your throat area and that fight the infecting agents, no? And they will enlarge and inflame and also cause suppuration or pus formation, which can be a source of the pain.
And aside from the pain, Dr. Ibay, could this inflammation also be the cause kung bakit nawawalan ng boses ang karamihan ng tao with a sore throat?
Yes, so accordingly, with the inflammation of the oropharynx, the hypopharynx, wherein the larynx or voice box sits, also can secondarily inflame and cause further dysphagia or dinophagia or pain on swallowing, and also cause hoarseness. No? Your vocal cords will inflame, thus giving you the raspy voice, or if not, no voice at all in severe cases.
Aside from the pain, the dryness, and irritation that one experiences, there are also other symptoms associated with a sore throat. Now, Dr. Ranely, ano-ano pa ba yung kailangan na bantayan, or at least what should our viewers know in order for them to know what to expect?
Yes, sore throat is very common. I'm sure most of us have experienced a sore throat, and most of the time we do home remedies. But if you have fever already, if it's more than 2-3 days fever, if you're having difficulty swallowing, just like what Dr. Ibay said, and if you really feel very weak because of the sore throat, then it's time to really come and see. Magpakonsulta po tayo sa doctor natin para mas ma-identify kung ano talaga yung cause at ma-address po ng maayos at kaagad-agad yung tamang cause ng sore throat po natin.
That's right. And there are so many symptoms to watch out for. But how do we know when it's not COVID-19? We'll find out after a short break. Please stay with us right here on Med Talk Health Talk on CNN Philippines. We are your partners in healthcare. This is Med Talk Health Talk, and I'm Dr. Freddy Gomez. During this pandemic, many of us are worried that when we have a cold, cough, or a sore throat, that we might have COVID-19. And yes, a sore throat may be a symptom. Now, Dr. Ranely, please explain how this is associated, how a sore throat is associated with COVID-19.
Well, for now, any sore throat can be considered COVID-19, di ba? So, based on what was explained also earlier, because the throat is exposed externally through the nose or through the mouth with viruses, which is how our COVID-19 is transmitted. That's why the throat is also one of the parts of the body which is the first to be affected by COVID-19. Kaya po isa sa mga common symptoms talaga na COVID-19 aside from fever is yung cough, yung colds plus sore throat.
Okay. That's right. Now, Dr. Ibay, if a person develops a sore throat, how will he or she know if it's due to allergies, maybe the flu, tonsillitis even, or COVID-19 na pala ito?
Well, of course, if it's allergies, if historically you did the Marie Kondo ka, you started cleaning around your house during the lockdown, and you're exposed to allergens, and of course, the exposure, the sore throat after the exposure will more or less give you the idea that this may have been due to exposure to the allergens causing postnasal drips. Now, if it's an infection, also historically, maybe you might, if you know that you were exposed to someone with a cough and a cold, and you have developed symptoms a few days after, then you might get the suspicion of having caught the flu or even the COVID. But we know that upon inhalation of the viral particles, nananatili siya sa nasopharynx natin for about 4 days before bababayan to the lower respiratory tract, no? Using mouthwashes or mouth rinses can possibly prevent escalation of your infection.
Okay. Now, Dr. Ranely, let's say you wake up with a sore throat. Should you be getting a COVID test right away?
Well, not necessarily, because if you are a known allergic patient, usually you get the symptoms most often in the morning. But I guess with the current situation now, it is best to consult a physician. You can do it through online teleconsults naman so that you can decide better whether or not you need to do a swab test already. But exposure is very critical. If you have been exposed to a patient na may COVID in the recent days before you had your symptom, then mas likely na baka kailangan mo ng mag-swab test.
And there are different types of medical conditions that can cause a sore throat, and strep throat is one of them. Dr. Ibay, could you please explain to our audience what happens when someone has strep or strep throat?
Well, it is an exposure to the bacteria, no, the Streptococcus bacteria, which will cause the tonsils to enlarge and also to suppurate. And you may form bacterial colonies within the pockets of your tonsils. And this may also result in high-grade fever and, of course, severe odynophagia or masakit sa paglunok. No? And also, this may cause joint aches and pains. And also, strep throat, as we know it, can also cause other problems. It can cause rheumatic heart if it's chronic, meaning you get frequent tonsillitis infections of more than 5 times in a year. Then this can lead to rheumatic heart, the valves of your heart being also eaten up basically by the infection. And also it may cause kidney problems, which in severe cases may lead to, in the future, kidney failure and kidney transplants.
That's right. So it's best whenever you have a bad case of the sore throat, you have fever, muscle and joint pains, better have it checked with a doctor in order to prevent further complications from happening. Now, how do you soothe a sore throat? There are remedies in addition to medicines that doctors will prescribe. We'll find out more after a short break. You're watching Med Talk Health Talk on CNN Philippines. We are here to build a healthier future for you. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk. Now, continuing the conversation with how to treat sore throat or sore throats in general, we'd like to talk about the diagnosis. So with this, I'd like to start off the discussion with Dr. Ibay. Dr. Ibay, diagnosis naman ang pag-usapan natin. So aside from the pain, which is your first signal that you have a sore throat, how will a doctor do a proper diagnosis on the type of sore throat that one is experiencing? And what can ancillary procedures such as, let's say, a complete blood count, how can this help in confirming the doctor's diagnosis?
Well, of course, the inflammation and the type of infection that's going on may be seen upon examination, oral examination. So we check if the sore throat sometimes may be caused by singaw, no? Mga singaw-like lesions. And then when you have those, you also have to check if there are other possible lesions that may lead to your diagnosis, like hand-foot-mouth disease, which is a virus, no? The Coxsackie virus. If you look at the tonsils, it's quite enlarged and there's a lot of pus coming out from the pockets or the tonsil crypts, then it might be actually a strep throat. So you can also diagnose that by doing a throat swab and a culture to determine what exactly the bacteria is that is infecting the patient. At pwede rin CBC, no, to check on the WBC count. Kung mataas ang segmenters or the neutrophils, it would lead more to a bacterial infection. At pagka mababa ang WBC count at mas mataas ang lymphocytes, then it might lean more towards viral infection.
Right. And of course, gusto natin gumaling kaagad. And depending on the type, as Dr. Ibay mentioned, the treatment will vary. And as we said, a sore throat can be either bacterial or viral. Now, Dr. Ibay, please explain the types of medicines that will or can be described for someone who is diagnosed with a sore throat.
Usually, viral infections are self-limiting. increase oral fluid intake, and also anti-inflammatory and antiseptic mouthwashes. These have proven to be anti-inflammatory and antiviral. Also, if it's a bacterial infection naman, in which case you give the proper antibiotics, ideally, depending on what the culture shows. You give a favorable antibiotic for the infecting agent or infecting bacteria, or you can just treat empirically with antibiotics.
Okay, very good. So something to take note there for our viewers. Kapag na-diagnose with a viral cause, antibiotics may not be needed for that. So it's best to have yourself checked with your doctor for them to determine kung ano ba talaga yung cause ng sore throat. Now, regardless of the cause, there are general home remedies to help ease a sore throat. So maraming pwede rin gawin habang nasa bahay. Dr. Ranely, please tell us more about what our viewers can do kapag nasa bahay in order to treat yung mga minor sore throats nila or sore throats that they are still monitoring.
Well, usually, effective pa rin yung advice ng ating mga lola. The usual warm water with salt gargle. It's still very effective in helping alleviate most of the symptoms of sore throat. Other studies would show na pwedeng mag-ice chips. But of course, you have to be careful with small substances when prescribing this to your kids, mostly for adults. Anything that soothes the throat, like turmeric tea, honey, there has been studies also supporting these remedies, home remedies for sore throat.
Mabuti na mention nyo yung mga bata, Dr. Ranely, because it's always hardest when infants and children get sick. Yung mga remedies ba sa sore throat, magkaiba ba kapag bata or mga infants ang pinag-uusapan, Dr. Ranely?
Well, if you have a very small child, kasi mas critical po talagang kailangan mas mabantayan yung mga bata. So if it's a very small child who has a sore throat, I would really suggest na mas okay pong magpakonsulta muna before giving home remedies. But for those who are toddlers na, older children, then kung marunong nang mag-gargle, tulad nung sinasabi ni, especially for more adolescents, pwede nang gawin yung mga sinabi ni Dr. Ibay na gargle. If there are mga sores, you could put yung mga parang ointment or cream na nilalagay sa bibig, pwede naman.
And syempre, rest is still very important. When you're not feeling well, that's what you need first and foremost. And since you can be contagious, isolate yourself. Drink plenty of water and eat well. Very basic things. And as we said, don't hesitate to consult with your doctor sooner rather than later. We'd like to thank our guest for today, ENT Head and Neck Surgeon Dr. Emmanuel Ibay and Family Medicine Specialist Dr. Ranely Mendoza. Thank you to all of you for joining us on MedTalk Health Talk. These days, we tend to be more vigilant than before about our health. And because sore throat is a symptom of COVID-19, we stress about it more at the first sign of discomfort. But a sore throat alone is not as ominous of a symptom as you might think. And chances are, it is simply more annoying than it is scary. A viral or bacterial infection that needs to be addressed. The key here is prevention. Build your body's natural defenses. Eat healthy and stay active. I'm Dr. Freddy Gomez. Thank you for watching MedTalk Health Talk. Stay safe, everyone.